Hi everyone, welcome back to my YouTube channel and today we are going to talk about medical imaging techniques. So let's start the topic with introduction. Medical imaging is a branch of medicine that uses various techniques to visualize the internal structures of body for diagnosis, monitoring and treatment planning. This technique allows non-invasive examination, enabling clinicians to detect abnormalities, guide intervention and evaluate the effectiveness of therapies. Advances in medical imaging have revolutionized diagnostic and patient care. Objectives: it detects and diagnoses diseases and injuries, it monitors the progression of disease, it guides therapeutic procedures such as surgery or biopsy, it evaluates treatment efficiency, it also assists in research and anatomical studies. Common medical imaging techniques. They include X-ray radiography, computed tomography, magnetic resonance imaging, ultrasound or sonography, nuclear medicine imaging, and fluoroscopy and other emerging techniques. Now let's talk about these one by one. First is X-ray radiography. It uses X-ray to pass through the body. Dense structures like bones absorb more radiation and appear white, while soft tissue appear darker. They are used for the bone fracture, dental examination, chest infections, and tumors. Advantages include it is quick, inexpensive, and widely available. Its limitations include that has limited soft tissue contrast and it causes exposure to ionizing radiations. Second medical imaging technique is computed tomography, that is also called as CT scan. It combines multiple X-ray images taken from different angles to create cross-sectional image of the body. It is used in trauma assessment, tumors, vascular conditions, lungs, and abdominal imaging. Its advantages include high resolution and detailed images of bones and soft tissues. Its limitations include higher radiation dose than X-ray and it is also expensive. Third medical imaging technique is magnetic resonance imaging, that is also called as MRI. It uses strong magnetic field and radio waves to generate detailed images of soft tissues. Uses include brain and spinal cord, joint, muscle, heart, and internal organs. Advantages include excellent soft tissue contrast and there is no ionizing radiation in this technique. Its limitations include it is expensive and it is contraindicated for patients with metal implants or pacemaker and it is time consuming. Fourth medical imaging technique is ultrasound, that is also called as sonography. It uses high frequency sound waves to reproduce real time images of internal organs. Its uses include in obstetrics to view abdominal organs, blood vessels and heart, that is also called as echocardiography. Advantages include it is safe, it is portable and real-time imaging is done through this. Its limitations include that it has limited penetration in bones or air-filled structure and it is operator depending procedure. Next medical imaging technique is nuclear imaging, medicine imaging, that involves administration of radioactive tracer that emit gamma rays and it is detected by special cameras. Its techniques include PET scan, that is also called as positron emission tomography, and SPECT scan, that is also called as single photon emission computed tomography. It is used in cancer detection, cardiac perfusion studies, and bone scans. It provides functional and metabolic information and not just structural thing, and that's why it is important. Its limitations include exposure to radiations, it is expensive, and it has limited anatomical details. Next medical imaging technique is fluoroscopy. Contains continuous X-ray beam that creates real-time moving images of internal structure. Uses include guiding catheter placement in gastrointestinal studies and orthopedic procedures. Its advantages include that it is real-time visualization and it is useful for procedural guidance. Its limitation is that it gives radiation exposure and limited soft tissue contrast. Next medical imaging technique include other emerging techniques that include optical imaging that use light to visualize tissue and it is used in research. Elastography that measures tissue stiffness and it is often combined with ultrasound or MRI. Photoacoustic imaging that combines light and sound waves for high resolution imaging of blood vessels and tumors. Factors to consider while doing medical imaging techniques. First, the nature of disease or injury. Second, target tissue, that may be bone, soft tissue, or organ. Third, the patient age and health condition. Fourth factor is safety concerns like radiation exposure and contrast agent allergies. Fifth factor is availability, cost, and time required. Safety consideration in medical imaging techniques. First, it involves minimizing exposure to ionizing radiations like during X-rays or CT scans. Screening patient for metal implants or pacemaker before MRI. Third safety consideration is to monitor contrast agent for allergic reaction or kidney function issues. And fourth is to follow ALARA principle, that is as low as reasonably achievable for additional radiation doses. Clinical applications of medical imaging techniques. First is in orthopedics, that is done for bone fractures and joint disorders. Second is neurology, as brain tumors, stroke, and spinal cord injuries are detected by the medical imaging techniques. Third application is in the cardiology, as coronary artery disease and heart function assessment is done by medical imaging techniques. Fourth application is oncology, as tumor detection, staging, and therapy monitoring is done by medical imaging technique. And fourth is obstetric and gynecology, as fetal development and pelvic disorders are detected by the medical imaging techniques. And the sixth is gastroenterology, as liver, pancreas, and gastrointestinal tract disorders are detected by medical imaging techniques. Conclusion of this lecture video: medical imaging techniques are vital tools in modern healthcare. They enhance diagnosis, guide treatment, and improve patient outcomes. Selection of appropriate imaging modality depends on the clinical question, patient safety, and available resources. Continuous advances in imaging technology promise earlier detection, better resolution, and safer procedure in the future. And this was all about medical imaging technique. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.